So, your dog has had a chronic goose-honking cough for over 2 months now, and no matter what you try, it does not seem to go away. Your dog may be suffering from chronic bronchitis. Watch this video as I'll be explaining exactly what chronic bronchitis in dogs is, as well as what the causes, clinical signs, diagnosis and treatment options are, so that you will be better equipped to understand what your dog is going through and thus be able to help him. Hey guys, Dogtorpete here. I am a veterinarian from South Africa. Now, in order to fully understand this condition, we first need to recap on some anatomy. The bronchi are the larger airways through which air is moved through the lungs. The trachea, aka the windpipe, brings air from the throat down into the chest and then branches into the two mainstem tubes called the bronchi, one for each of the lungs. Now, each mainstem bronchus then branches into smaller bronchi, which then eventually becomes smaller structures called bronchioles, which in turn also branch again to eventually terminate on the alveoli, which are basically small chambers where oxygen is absorbed into our bodies from the air that we inhale. Now, these bronchi are mostly made out of cartilage, and when they are injured, they respond with a healing process by means of an inflammatory process. When the injury continues for a long time, the inflammatory healing process also continues, and this ends up producing excessive amounts of mucus in the airways. And as this mucus moves down the bronchi, they eventually obstruct the smaller bronchioles, which then triggers a coughing reflex to try and get rid of it. This in turn leads to more irritation, more inflammation, and eventually more mucus formation. So I'm sure you can see how this can turn into a rather nasty vicious cycle. Now, if this vicious cycle of mucus production to coughing to inflammation to more mucus production continues for a very long time, it becomes very difficult to cure. And this is why we refer to this condition as a chronic bronchitis. At this stage, we expect to see some reactive changes within the lungs, which can include something like a dilatation of portions of the small airways, aka bronchiectasis, as well as scarring inside the lungs, what we call pulmonary fibrosis. Now, this condition might start off as a temporary bronchitis, such as what we see with diseases such as kennel cough, but if the dog continues to cough for a very long time, meaning at least once a day for a couple of months, then this becomes a chronic problem. Dogs with chronic bronchitis generally have a persistent, dry, hacking cough, which almost sounds like a goose honk. The coughing often occurs during the night or when a dog first starts to move upon waking up. It also commonly occurs when the dog is excited, when he is stressed, when pressure is applied to the windpipe from a collar, or just after exercise. You may also see your dog gagging afterwards as he tries to clear the mucus from the airways. Now, when this condition worsens, dogs will start having a much greater difficulty breathing, will have a lower tolerance for exercise, and may eventually faint when overexcited. At this stage, you may hear your dog making a wheezing sound when exhaling, which is a symptom we commonly see with restricted airways. In worst case scenarios, your dog may suffer from oxygen deprivation, which may lead to the gums developing a bluish tinge and even cause the dog to pass out after exercise. Now, chronic bronchitis, meaning it happens over the long term, is usually the end result of acute bronchitis, which develops very rapidly. Acute bronchitis can be caused by any infectious agent such as viruses like parainfluenza virus, adenovirus, canine influenza virus, and distemper virus, as well as bacteria such as Bordetella bronchoseptica, noxious irritants such as secondhand smoke, foreign bodies, allergens, and even migrating lung parasites. Now, many of these acute bronchitis cases will generally resolve with appropriate therapy from your veterinarian. However, if the bronchitis persists for long enough, the cough itself will begin to cause and perpetuate the airway inflammation. Now, it is important to note that there are many causes of an ongoing cough, and bronchitis is certainly not the only one. Other diseases may include pneumonia, tracheal collapse, laryngeal paralysis, heart failure, heartworm infection, and cancer. Canine asthma is also possible, but the difference here is that asthma usually involves recurring episodes of airway inflammation and narrowing, rather than a continuous non-episodic airway inflammation such as chronic bronchitis. Now, chronic bronchitis is a diagnosis of exclusion, meaning that we first need to rule out other diseases that can cause similar clinical signs as mentioned earlier. Your vet will start off with getting a full history with regards to your dog's cough, and will then proceed to perform a full clinical exam of your dog, where he will specifically listen to the heart and the lungs and palpate the dog's throat to see if he can find any abnormalities. With chronic bronchitis, we typically hear crackles, which are basically harsh crackling or popping sounds heard on the lungs when the dog breathes in and out. After this, your vet will strongly recommend taking thoracic x-rays, as this is crucial to rule out other conditions that may also affect the lungs and the heart, which will result in a similar cough. With bronchitis, the mucus in the airways tend to outline the shape of the airways that may look either like tram lines or donuts on the x-ray. If the bronchitis is very advanced, we will usually also see the airways being dilated as well. Now, ideally, we would also like to perform a bronchoscopy, where a small camera is basically passed down the dog's trachea into the bronchi to look at the structures and conformation inside these tubes. We can then also perform a BAL, or bronchoalveolar lavage, where we basically flush and aspirate a little bit of fluid down in the bronchus to basically analyze the airway secretions. Alternatively, a TTA, or transtracheal wash, can also be performed, which works very similar to a BAL, where we basically flush and aspirate the tracheal secretions, except we only go as far as the trachea and we don't really need a camera for this. Now, it is important to note that sedation or even general anesthesia is often required for a BAL or TTA, and these are not without risk in patients that already have a compromised lung capacity. So the benefits of obtaining diagnostic information must always be weighed against the potential patient risk. What often happens is we will skip these invasive procedures and rather administer a trial course of medication to see how the dog responds. And in addition to all of this, your vet may also decide to perform an echocardiography, which is basically an ultrasound of the heart, as well as a fecal analysis to rule out heart failure and parasites respectively. Now, as you can see, the prolonged inflammation from chronic bronchitis can lead to some non-reversible changes within the airway structure. The key to disease management is therefore to control the airway inflammation with medication and to modify the dog's environment to at least help prevent the airways from being further irritated and damaged. Now, luckily, there are many different things that we can try to relieve the dog's cough, and your vet may choose to try a combination of these things to see what works best in your dog's specific case. First up is corticosteroids. Now, these work best by relieving the inflammation and thus reducing the amount of mucus production within the airways. We will typically start with a short standard dose and then taper it down to the lowest maintenance dose. If your dog shows any side effects to the oral corticosteroids, then we can also try inhaled steroids, such as the AeroDog chamber, which I will link down in the description, as an alternative. This is administered by using a special face mask, which is very similar to what humans that have asthma use. These were great because they deliver the medication directly to the lung tissue instead of needing to be absorbed through the blood, which drastically minimizes the potential side effects that we can see in oral steroids. Next up is cough suppressants. If we can suppress the cough, then we have a good chance of stopping the cough irritation vicious cycle. So medication such as hydrocodone and butorphanol work quite well by suppressing the cough reflex. Now note that over-the-counter human cough suppressants are often ineffective and may be combined with additional harmful medication. So never ever medicate your pet without first checking with your vet beforehand. Next is airway dilators. These basically help by relaxing the walls of the smaller airways to allow air to flow past the mucus that previously blocked these chambers. Examples of airway dilators that we commonly use include albuterol, terbutaline and theophylline. And lastly, we may also try mucolytics such as bromhexine, as these help to break down the structure of the mucus by creating a more watery secretion that is much easier to clear. Now, using antibiotics in chronic bronchitis is kind of debatable. Chronic bronchitis is not an infectious disease per se, but considering all the inflammation and mucus that build up inside the lungs, this does compromise the patient and makes them more susceptible to infection, as they have a more difficult time to clear any inhaled bacteria. We may also sometimes try antibiotics in the very early treatment course to rule out any infectious cause of the cough before we even try corticosteroids. Now, when the dog is home, there are a couple of things that you can also try to help reduce these coughing episodes. First, you can use a vaporizer or nebulizer to help moisten the respiratory secretion and thus to make it easier to clear. If you don't have either of these, then let your dog walk around in the closed bathroom while you take a shower or bath, as the steam generated from the heat also help to moisten the mucus. Next, you can try coupage therapy. This basically entails patting and massaging your dog on the chest with controlled cupped hands to try and move the moistened secretions into the more central airways so that they can be more easily coughed up. Now, make sure to ask your vet to show you exactly how to do this correctly so that you don't accidentally injure your dog. If your dog is overweight, then focus on reducing his weight gradually. Excessive fat causes extra pressure on the chest, and this compromises the dog's ability to take a deep breath. Many dogs with chronic coughs actually recover completely without any medication after they have lost a few pounds. So this is definitely something to focus on. And lastly, something quite obvious, minimize airway irritants. If you smoke, smoke outside. Avoid spraying perfumes, scented products or aerosols near your dog. And if you are remodeling your house and there are open cans of paint or cleaning equipment, then keep your dog in a separate area so that it does not get into contact with these irritants. Also, consider installing a good air filter to help minimize the dust, pollens and mold inside the air. And what will also really help your vet is if you can keep a logbook to track the frequency and the severity of the coughing episodes in order to monitor how successful the treatment is. Now, it is important for dogs with chronic bronchitis to actually cough up the inflammatory secretions as long as the coughing does not become excessive and aggravate the inflammation. It is not always easy to draw the line as to when the cough is helpful and when it is excessive, and thus it is very important to work closely with your veterinarian and to take your dog back to the vet for frequent follow-up checks to see if the medication he currently is on helps and if the treatment plan needs to be adapted. Now, dogs cannot get bronchitis from humans, nor can it be passed from dogs to humans. It is also not infectious or contagious to other dogs, given that other infectious causes have been ruled out. So, as you can see, chronic bronchitis is the end result of ongoing airway change and may therefore never be fully cured. But the symptoms thereof are generally rather easy to manage for most patients and can keep them comfortable to live a long and happy life with a normal life expectancy. Thank you for watching this video, guys. If you are not yet convinced that your dog is suffering from chronic bronchitis, then make sure to check out my video over here where I go through the top 8 most common causes of coughing in dogs so that you might get a better idea of what your dog is dealing with. And if you found this video to be helpful, I would really appreciate it if you can leave a like on this video and share it with your friends and your family. And if you are new to my channel, consider subscribing, as I'll be posting new videos on interesting pet-related topics every week. And as always, have a lucky day, and I'll see you in another video next week. Cheers!